Hello, my name is Chang. Today I'm going to talk about OpenSRH, our paper in Europe's 2022 Datasets and Benchmark track. One of the most important problems in neurosurgery is brain tumor diagnosis. Brain tumor patients will often come to see clinicians after they have had a seizure, headache, or a new neurologic deficit. They will get an MRI, and the MRI may look something like this. We can see that there is a lesion in the brain, but ultimately this does not give us a diagnosis. The only way to get a diagnosis is to obtain tissue from the tumors, but there are many ways to get tissues, ranging from a small biopsy to a total resection. Diagnosis is very important because it determines the treatment. Oftentimes, we don't want to do an aggressive surgery on tumors that respond really well to chemotherapy or radiotherapy. What happens to these patients is that they will undergo surgery and a specimen will be taken from the tumor and the specimen will be sent through a pathology workflow that is time, resource, and labor intensive. Here is what I mean. These specimens need to undergo extensive tissue processing such as fixing, sectioning, and staining by a highly skilled histological workforce. Once the images are acquired, they are sent to a neuropathologist for the diagnosis. This process can take up to 2 hours, all while the neurosurgeon is waiting in the operating room. This is not an optimal workflow. An ideal intraoperative tumor evaluation process should be accessible everywhere with little to no requirement of highly trained staff. It should be fast because a longer diagnosis time could lead to complications during surgery. It should be standardized across different patient demographics, clinical workforce, and geographic location, and accurate when compared to existing standard of care. Stimulated Raman histology is an imaging technology that can enable such an ideal system. Instead of imaging using specimens in a pathology lab using conventional staining procedure, we use an optical microscope to produce high-quality and high-resolution images. And in addition of neuropathologists evaluating these slides, we're developing AI algorithms to assist them. The best part about SRH is that we can get these histology images in under a minute. And that's why SRH is being used clinically at the University of Michigan and many other centers across the United States and in Europe. But none of these clinical data is available. And that's what we're trying to change with OpenSRH. OpenSRH is the first and only publicly available SRH dataset with clinical data. Here are a few examples of SRH images from the dataset we released. We included the most common types of brain tumors, including gliomas, skull-base tumors, and metastasis. We divided our data into training and validation sets by patient, with the breakdown represented on the screen. Each SRH image is patched into smaller regions for model training. We performed classification benchmarks on the released OpenSRH data, and we can see that ResNet architecture with ImageNet initialization performs the best in patch metrics. We can also aggregate patch predictions for a patient-level prediction. The model performs really well overall, but the models tend to make mistakes in high-grade low-grade gliomas and metastasis. These results correspond to the neuropathology domain knowledge that we have, as glioma grading is a very challenging problem even for seasoned physicians, and metastasis is known to be very diverse based on the tumor origin. In addition to classification benchmarks, we also perform contrastive learning. The learned representations from these algorithms are evaluated using linear classification. As expected, supervised contrastive learning performs the best across all metrics. We further visualized these learned representations using t-SNE and observed meaningful SRH feature clusters. More details about our benchmarks and experiments can be found in our paper. In conclusion, we hope OpenSRH will promote translational AI research and encourage open science. More details about our paper, including some interactive image demos, are available on our website, opensrh.mlins.org. And finally, I would like to thank our co-authors and collaborators in the Machine Learning and Neurosurgery Lab here at the University of Michigan. And I would like to extend our gratitude to our sponsors whose generosity makes this research possible. Thank you.